Welcome to Myovision and an introduction to the new 3G wire-free system. The new 3G wire-free system that we developed in the last few years is based on the 3G wireless system, not Bluetooth technology. And the reason we did that is because the technology is more solid and sound and has a greater distance, and you're not going to find getting halfway through a test, you're losing your wireless connection and having to start all over again. This is an example of the static exam. It is an incredible tool for screenings, for patient retention, for marketing. It's a test you're going to do once every few weeks and track patients' progress and show them how their muscle activity is changing from month to month. There's a direct correlation between a spinal adjustment and a change in muscle activity, and patients see this and they get it. And when you can actually show them instead of just telling them where their muscle activity is unusual, this is a really incredible selling tool. I like to call it electronic palpation, but instead of just palpating and telling them, you're now palpating electronically and showing them. This is the design of the new system. If you have our old system, or if you've seen it, it looks like the one on the bottom. It's a 3-probe device. The new system has 5 probes, so it does a test in half the time. The center probe is spring-loaded, so when you put pressure down on the skin, it automatically knows how much pressure to put. So it's virtually impossible to make a mistake doing a test. The entire static test takes 30 to 60 seconds. The powerful part of what static EMG provides chiropractic offices is the ability not just to tell, but to actually show. And when you can add a picture and graphics to your description of chiropractic and how you can treat and help a patient, this is a home run for a lot of doctors. What you're also able to do is print out an exam and actually give them something that they can actually take home. This is an incredible tool for in-house marketing, for patient referrals and retention. It just goes through the roof because patients actually want to see what's going on with their back from one month to the next. Now, moving away from static EMG, when we developed the wire-free system, what we were able to do is something we've always wanted to do, which is to take range of motion and combine it with dynamic EMG. Since we did it, this gentleman, Dr. John Gearhart, who wrote the AMA Guide to Range of Motion Assessment, endorsed the product. And the reason he did it is because he realized that range of motion by itself was not the best tool to objectively show loss of function, because it's hard to always know whether a patient is actually making that full range of motion that you're hoping they're doing. But when we combined it with dynamic EMG, so now it's done simultaneously, this proved to him that what we're doing is a way to truly prove loss of function, because we're not only seeing how far someone can move, but we're actually showing muscle activity and effort. So we can actually, we're doing it at the exact same time. It's also a great way for, on the converse, when you have a patient that you know has loss of function, but when you do range of motion exams on them and they're totally normal, because some people are just sort of built that way, well, now we're giving you another dimension, so you're not stuck in a PI case with just a range of motion test that appears to be just normal. This was another turning point for us as a company. Back in 2005, a doctor in the state of Florida was requesting help with not getting paid on for his dynamic EMG reports or exams, and he asked all the manufacturers to assist, and we're the only ones who did. And as a result, we won this court case, not just in the lower court, but in the Superior Court of Florida, which was a huge turning point, because we were not just fighting the state of Florida, we won against essentially the insurance industry. Here's an example of dynamic EMG with range of motion, what we call the Dynarom. This is changing everything. It's rewriting the way we document, and there's no other tool that can show loss of function better. As you can see from the exam, we're doing it all at the same time, and if you look at the two graphics, The two top ones, for instance, show what a normal looks like, where you can actually see the range of motion, which is the bottom XY graph, and the dynamic EMG in the top. The blue is the left paraspinal muscle, the red is the right. We can see what happens in full flexion when muscles shut off, and we can see the reaction when someone returns to neutral. On the bottom two graphs, that's an abnormal. Now the range of motion appears to be normal, but here's a great example of if you had done the Dynaram, you could have proven a case and helped your patient, because when this patient's fully flexed, they can't shut their muscles off. As we can see from that first arrow, their muscles continue to fire in full flexion because they essentially have to recruit muscles to hold their posture. We're seeing all sort of erratic muscle activity and guarding, and this is an incredible way to prove loss of function for your PI cases or insurance cases. It's very quickly becoming a bulletproof way to create a very powerful, strong PI practice. PI attorneys, when they're now learning more and more about what we provide, want to see doctors that are using the Myovision. This study, the only reason it's in here is and it's back to static a little bit, it's only because when we compare ourselves with other systems, and all systems have something to offer, but we just tend to have a lot more going for us in terms of proving documentation, and of course we're the only systems that's fully wire free. But this study proved that the standing EMG is the best way to do the static testing. There's just a huge difference when you're doing weight bearing versus seated exams. Now, regarding CPT codes, this is the two codes that are used that are the AMA CPT codes. The 96002 is for the test itself, and the 04 is for the interpretation. These you can see the RVU values. The interpretation is much more heavily weighted, and there are actually companies that do it for you if you choose. But I highly recommend my customers to learn how to do interpretations for themselves. One of the services I provide is I assist doctors in learning how to do their own interpretations. Okay. Then when you add to it the range of motion test, I have many doctors that are billing out at $200 to $300 per test successfully with the dynamic EMG, with the test and the interpretation, and the range of motion. Now, what changed dentistry? I like this graphic because this, if you recall those tabs that they made us chew many years ago, it changed dentistry from emergency care to preventative care, because it showed us and the dentist what was happening and what they can do to prevent future problems. Okay, and that is how we like to see the Myovision, is that it helps chiropractors become a maintenance and preventative type practice versus just simply emergency care. Here's a recent EOB with the dynamic SEMG. Doctors like to be able to see this so they can. Now, there's most of my customers easily make back the price of their system just doing static EMG testing with referrals, with an increased retention. Just imagine your retention rates going up 10, 20, 30%. It changes everything. But you add to it X number of billed exams or PI cases per month, and it's very easy to see why this is not a purchase, this is an investment. Here's another EOB. This is a very poor quality. I apologize for this, but I can always email you the PDFs on these as well. Now, this was a game changer. This past year, the AMA actually pictured us in their most recent range of motion assessment guide. And that's the book, and the picture on the right is actually our equipment being used, the two bottom pictures. That's a lumbar Dynaram being performed. This is excellent for us and for our customers because it's simply instant credibility, plain and simple. Here's the full system. We also offer a thermography as well, which is called our Thermoglide, but everything is wireless, including our Thermoglide. And basically what you're seeing here is on the right is the static EMGs. That's what they look like. Then the Dynaram on the far left, the range of motion devices, and then the box next to the static EMGs, that's your dynamic EMG. So your entire system is very simple. It doesn't take up much space, and being wireless is just far more efficient. As a matter of fact, the static EMG, one of the other advantages is for doctors that do use it for screenings, you're no longer tied or tethered to the computer. Now you can actually go out among a crowd of people and do testing from 10 feet, 20 feet. I've done this over 100 feet away, and it works perfectly. So if you're in one of my groups, this is the package that you get. I don't include the table on the top. They're far too expensive and too heavy to ship. We used to do that, but you can always pick up something yourself very easily and much less money than these. But basically, it's the full system is the static, the dynamic, and the range of motion. The thermoglide is an option you can always add, but the bottom is something really nice. I include the Hewlett-Packard TouchSmart computer. And the beauty of that is that with the static EMG, you or the patient can touch the screen with your finger, as you can see in the middle picture. And by touching your finger to the screen, it pulls up the organs and symptoms associated with subluxations at each level. That's the main function currently for the touchscreen, but it's very powerful. It might be a bit of a bell and whistle, but it's also great for patients because it allows them to interact with their treatment protocols or their treatment and the exam itself, and it gets them more involved. So, main purposes of our full system. Patient retention. This is huge. In terms of increasing your patient retention, there's nothing like it. We are not a tool that proves pain. We are a tool that proves function. We're looking at function. So even when a patient emerges from pain, we can see on their graphics that they may need more work just based on their muscle function. And that's where patient retention comes into play. Patient referrals. We have some really nice things that we can provide you, whether it's postcards for reactivation of previous patients or free certificates you can give current patients that can give to friends and family members that you can use as a referral so they can come in for a free exam. Number 4, for PI work, this is becoming essential. It's kind of a no-brainer in many ways because there's just not many exams that can prove loss of function as well as we can. And now that attorneys see that we're in places like the AMA's guidebook itself, this is becoming for them, it's like going into a knife fight with a gun. And then, of course, with insurance, you have the reimbursement, the billing codes that I had mentioned earlier. So here's my direct information. One of the things that I provide my personal customers, along with assisting them in the system setup, though we do have tech support for that as well, one of the things that really does help my own customers is that I provide a lot of hands-on help with them when it comes to interpretation of exams. So whether you fax an exam to me or I go take a peek at your computer via a GoToMeeting software online, I can actually review exams with you. And in the first few, it's very helpful when I can actually do that for you. But my phone number is direct, the 888-368-2766 number, and of course my email at mark@myovision.com. Thank you very much, and feel free to contact me.